Today on Dueling Doctors, we're taking charge of our health. Three big issues: birth control, depression, and premenstrual syndrome. There is so much information out there, so how do you make the right decision for you? Doctors from the world of holistic natural and conventional Western medicine square off about how to take charge of your life and your health right now. It's holistic and natural versus conventional health experts with different opinions and one goal: to help you live a healthier life. Dueling Doctors. Hi everyone, I'm Dr. Frank Spinelli. Each week on Dueling Doctors, experts from the world of both conventional and holistic medicine debate and discuss the best ways to treat common conditions. Let's get started by introducing our guests. On the holistic side of the equation is licensed and board-certified naturopath Dr. Maura Henninger. And with a more Western approach with a specialty in internal medicine, we have Dr. Nancy Simpkins. Welcome, both of you.
Thank you. Nice to be here.
Our first topic is birth control. There's nothing more nerve-wracking than trying to keep track of it. You're telling me. And there's also so many options. How do you know which one's right for you? Birth control options come in all shapes and sizes, including a pill, a patch, a ring, and an intrauterine device also known as an IUD. Each contains a small amount of man-made hormones that work to inhibit the body's natural cycle to prevent pregnancy. So now you know what it does. How do you take charge of your birth control? Each of our experts has up to 1 minute to present their thoughts, and then the other will be given the opportunity to respond. We flipped a coin before the show to see who would go first. And guess what? Dr. Simpkins, you are up first. So,
all right.
How do you approach a young woman that comes in and says, I don't want to have a baby,
right,
but I want to have sex?
Okay, so for most people, the decision is what works for their lifestyle. So if your lifestyle is that you're in a monogamous relationship and your number one reason is to prevent pregnancy, the number one thing we recommend is the oral contraceptive pill. They come in all forms. They have various amounts of estrogen and progesterone. That's based on your doctor and you and your history.
What are the things you worry about with a young woman that you might ask her before you prescribe birth control?
Number one thing is smoking. Smoking and birth control pills do not mix, and that is for the fear of blood clots. Smoking increases the risk in a young woman of having blood clots in the leg, which could potentially break off and go to the lung and kill someone.
Clots in the leg are called deep vein thrombosis,
right, and
some, on occasion, they can get dislodged and go to the lungs, and that's called a pulmonary embolism.
Right, which could be fatal.
Which could be fatal, and it's really a high risk if you're a smoker and you're on birth control.
Right, so I tend to discourage young girls who smoke from taking the pill and would prefer that they use other forms of birth control. By the way, using condoms and spermicide gel together is as effective as using the pill.
Dr. Henninger,
yeah.
Woman comes in, same story. She wants to talk about not having a baby, but she wants to be sexually active. So what is the naturopathic approach?
So the natural approach is not birth control pill. I see a lot of drawbacks with that, introducing exogenous hormone into the body. So I suggest a number of different things. So condom is one. Okay. The rhythm method is something that I, can advise some.
So what is the rhythm method? Because I'm not really sure. I went to Catholic school, but I never understood it, and thank God I don't have to practice it.
So certain times of the month, a woman is fertile, and certain times she isn't, essentially. So how
do you know when she's not fertile?
So we're testing basal body temperature. We're charting. At ovulation and the days prior is when a woman is most fertile.
So really, a sexually active woman has to wait for this period to have sex if she wants to avoid a pregnancy.
Correct.
And so what is your opposition to the birth control pill? So you said exogenous hormones you don't want to.
Sure. So birth control pill is often given, for contraceptive purposes. But in my practice, I see a lot of women going on birth control, being put on birth control for acne, for PMS, things like that. And it's more of a Band-Aid rather than actually a cure to the problem.
If a woman had acne or premenstrual syndrome or irregular periods, a doctor might prescribe birth control to keep that regulated.
Correct. And the problem is there are a lot of side effects with that: weight gain, loss of libido. We see inability to absorb vitamins and minerals, blood clots, as we already spoke about. So there's a lot of drawbacks to it, and ultimately the fundamental hormonal imbalance is not being addressed.
Right.
So that's what we like to do.
Nancy, I don't know. I mean, what are you going to do? I understand
rhythm. Listen, I'm the mother of three.
women that practice rhythm?
Right, mothers.
Yeah.
No, I'm joking.
Right.
I'm teasing.
I am not a big fan of rhythm, obviously.
But she did say condoms as well.
Condoms,
which I'm very
And
big proponent.
diaphragm and copper IUD are
Right.
also two big things that I recommend.
Right.
Also copper IUD
Copper
as well.
IUD, absolutely.
I'm not saying that the pill is the only way, but it is far and away the most effective
And
way.
what about cancer risk with being on the pill?
Okay, so all of those initial studies about breast, uterine, and ovarian cancer have been disproved. There is no increased risk unless you yourself have had previous breast cancer.
All right, how
then
do you
it's
feel
a
about
no-no.
that? Are you okay with the cancer risk and birth control pill, or is this
I tend to
just off the
I tend to
table?
disagree with that. I mean, people, women, even who aren't predisposed to an estrogen-positive cancer or fibroid, can end up with something like an estrogen-positive fibroid. So it's sort of a precursor.
Right.
You're putting estrogen into your body every day of the month, basically, essentially.
So anything else that you recommend besides the IUD, you said, rhythm method, and what else?
Diaphragm is a big one that I
So
like to
diaphragm.
recommend to patients. It's a bit of a throwback. People think the 70s, the diaphragm, but it's wonderfully effective. No side effects whatsoever. You can keep it in 6 hours before sex, 6 hours after, and the efficacy rate is very high.
And the woman can carry it around with her.
If
Oh,
you
no,
like
don't-
having that in. So,
Oh, really?
okay, let's just leave that alone.
No,
but
it's not a good feeling?
I mean,
is
first
it
of all,
like
it's
the equivalent?
87% effective.
So it's not.
87 as opposed to 99.
With
So-
spermicide, though, the efficacy rate goes up.
Agreed.
So you have to carry around your diaphragm, and you have to carry around spermicide.
And you have to kind of leave it in there, and that,
But you can't
It's-
feel it. You can't feel it
You
when
can't
it's
feel
in.
it. It's
No.
not like men say, oh, it's a different
No, no, no.
sensation when I wear a condom.
Okay, well, I have many patients who complain,
They complain
that they
they
can
don't.
feel it. Women complain that they can
All
feel
right.
it, not men.
Well, a lot of good information. We have to take a break. Coming up, ways to cope with conquering depression. We'll be right back. Oh my God. So lots of, you get a lot of women that want pill, I would imagine. Welcome back to Dueling Doctors, the show where health experts from the world of conventional Western and holistic natural medicine debate the best ways to treat common ailments that affect us all. Today's topic, taking charge of our health. We're joined by Western-trained Dr. Nancy Simpkins, and here with her holistic training is Dr. Maura Henninger. It's time to talk about a more difficult topic, and one that comes up among many of my patients and even some of my friends, depression. True clinical depression is a mood disorder in which feelings of sadness, loss, anger, or frustration interfere with everyday life, lasting weeks or longer. Worldwide, more than 350 million people of all ages suffer from depression. So now you know what it is. What is the best way to treat it? Dr. Simpkins, you went up first last time, so we're going to give Dr. Henninger the go now. So a patient comes in, tells you, I just don't feel like getting out of bed. I'm not eating. I just don't want to do anything.
Yes.
What's the approach you take with them?
So there's three big things that I look at with depression. One is diet, the other is gut health, and the third one is exercise.
All right, let's start with diet.
Yep.
What are you looking at specifically?
So I'm looking at where the food allergens are. Typically, food allergens can create inflammation in the gut, which can then create inflammation in the brain. So big ones are gluten, dairy, and also animal fats can have the same effect.
Is having foods that are high glycemic index, carbohydrates, more prone to people that have depression?
Absolutely.
Do they tend to eat more carbs?
Absolutely,
So
more
you recommend
carbs.
low carbohydrates?
Low carbohydrates, I often recommend the Mediterranean diet. There's also a diet called the GAPS diet, which is very specific
Okay,
to
Mediterranean would be what?
Mediterranean
Food specifically.
So a lot of olive oil, a lot of green leafies, whole grains, that sort of thing.
And
Low
what was
animal
the
fat.
other diet you said?
The GAPS diet, which
What's
is it's actually a gut-associated psychology diet, which is actually to repair the gut. A lot of people with depression have a leaky gut syndrome, so this diet actually helps to repair.
So
gut.
why is the gut so important for people with depression?
So there's more neurotransmitters in the gut than there are in the brain. Actually, 90% of serotonin is produced in the gut.
And serotonin is what's linked to depression.
Exactly. SSRIs are
And SSRIs are serotonin reuptake
Reuptake
inhibitors.
Correct.
So that you get more serotonin and that makes your mood better. All right.
Correct.
So you mentioned diet. What was the second thing?
So diet, nutrition and diet, same thing. And then we also look at exercise. So exercise to me, is sort of the #1 treatment for depression. In a trial with Zoloft, it came out on top by far and away.
Really? Patients who just exercised versus patients who took Zoloft, which is a type of SSRI, which is serotonin reuptake inhibitor, and it outdid Zoloft.
Outdid it by a landslide.
Wow.
So even small amounts of movement every day can really make a big effect on depression. I find that my patients who have really clinical depression, serious depression, are not moving. They're in bed.
Okay. So what else would you recommend, maybe like oral supplements that you would prescribe somebody?
Sure. So St. John's wort is one big one. We do some amino acid.
And St. John's wort, I know, like in Germany, is like the most prescribed medication for depression. It's the standard of care, and not so much here, though.
No, not so much here. The pharmaceutical industry is pretty powerful here as compared to Germany.
You think it's a conspiracy with the pharmaceutical
not
companies that make it so
Not
long?
conspiracy. Just there's more doctors are just they know more about the pharmaceuticals.
And do you look at adrenal function in patients that are depressed?
Absolutely. We look at adrenal function. We do some cortisol testing, which is the hormone that will indicate how the adrenals are functioning, and if they're low functioning, which can lead to fatigue and depression.
Right.
We do herbs, ashwagandha, rhodiola, ginseng, those sorts of things.
Rhodiola, very good. I know it's the Viking drug, gives you stamina.
Yeah.
And what was the first one?
Ashwagandha.
Like ginseng.
Yeah,
like
which is also a ginseng. Yep, exactly.
All right, Nancy, you've been very quiet. Very atypical. You have nothing to say?
Let me just say one thing before I start.
Just one thing? I
Just
doubt
one thing
that.
I'm going to start with. Carbohydrates. Interestingly enough, there was a study in women that showed that carbohydrates actually increase serotonin levels. So contrary to what my Eastern counterpart was saying,
is that true?
There's a difference between carbohydrates. There's carbohydrates and then there's carbohydrates. There's simple carbohydrates, which are white bread and sugar and that sort of thing. Complex carbohydrates, which I believe is what they studied, are actually helpful.
So my mother making bread is what I would eat to make me happy.
Right, well, there's a reason why people gravitate towards carbohydrates, especially women, because it has been shown in studies that it actually increases serotonin levels. So that's just something that I would beg to differ from your original comments. And then my second point would be...
I don't think I like your tone.
Okay, if I was lying in a bed and I was pretty depressed, I would want something to be working quickly. So we find that medications such as Prozac, Paxil, Zoloft, Lexapro, even though we give them...
Those are all drugs in the pantheon of serotonin reuptake inhibitors.
Correct, that have been around a long
SSRIs.
time. Side effects have been well studied and documented. We find that even though it takes 2 to 3 weeks for a full therapeutic effect, within 24 to 48 hours, patients feel better.
Feel that their mood is better.
Feel that their mood is better. They're getting up.
As you said, there are side effects. I mean,
there are side effects to any medication.
Absolutely, but SSRIs, serotonin reuptake inhibitors, are known to cause sexual dysfunction, weight gain, problems with sleep patterns. I mean, that's a given. I mean,
that is a given. That is a given, and sleep disturbance is a problem for most of them. We have to play around with them. The truth of the matter is, if you're depressed, your sexual function is not great anyway.
Yeah, but there's a difference between being asexual, not wanting to have sex because you're depressed, and then being in a better mood and then wanting to have sex and then can't.
Losing all of your, agreed. This is why you need to be under the care of a physician who can work with you. We give drugs anywhere from 3 weeks to 3 months, and we say during that course of time, what is the risk-benefit ratio?
Okay, so how long do you recommend being on an antidepressant?
Depending on the situation. If it's a reactive depression, a death in the family, something that's short-term, 3 to 6 months is plenty.
Yeah, because I think that's not what happens.
No, that is not what happens.
I think people stay on antidepressants
for years.
For years, do you agree?
Absolutely.
And then they come to you and they say, now I'm on an antidepressant and I'm depressed.
Right, exactly. There's a rebound effect. Oftentimes they don't work or stop working, and then patients come to me, what do I do?
And so then you would then advise them to go off it?
That's when I add an exercise, diet, that sort of thing. I work with other medical doctors to bring people off of antidepressants,
And do you ever begin weaning them off?
Oh, I think the actual taper
I think that's
is
a very
the important part
of this, is that you can't just stop your antidepressant.
You must be tapered by a doctor.
Unless it's by a doctor's guidance.
Exactly.
Sure.
And there are real medical ways that can control serotonin levels while during the taper.
Okay. So. All right. Thank you very much. We need to take a break, but when we come back, we're putting PMS in its place. I was going to say the adaptogens. Is that, we say that word?
Yeah.
I didn't get to say that word.
But that's what those are.
Yeah. Welcome back to Dueling Doctors. We're empowering everyone today by taking charge of their health. Now it's time to talk about an issue that affects many women, especially those in my family, PMS. Did you know 3 out of every 4 menstruating women experiences some form of PMS, especially women in their 20s and 30s? Symptoms include joint or muscle pain, tender breasts, acne, headaches, and fluid retention. In addition, women may also experience anxiety, mood swings, and insomnia. Sounds like all the ingredients for a good time, right? It's no fun to be a woman. Each of our doctors has up to 1 minute to present a treatment plan. Dr. Simpkins, what do you think about PMS?
All right, it's miserable for most women. Every girl has some degree of PMS.
Especially in the beginning, when they're first starting to get
Right, when their
periods.
cycles are irregular and the hormones are fluctuating.
And they're heavier.
Right, the PMS is caused by fluctuations in hormones. The high level with the rapid drop-off right before the menstrual cycle begins. So that fluctuation in hormones causes a lot of all those bad things like breast tenderness and fatigue and weight gain and acne and just the feeling of lethargy and depression. People really don't feel well.
I've treated women for PMS, and really it's almost like it goes above and beyond that for some women, where it is the syndrome. It's not only the fatigue, it's not only the water retention, but just almost like in addition, a depression that goes along with it, where they don't want to leave the house or they're lying in bed. And I find that those are the patients that actually come in to see their
But those
doctor.
are the people who need treatment.
Okay,
because
what would that
for
be?
a week a month, you cannot be out of work. In a week a month, you can't be taking care of your family.
You have to
or a
be
week
function.
Right, you have to function. So what can we do? First of all, girls that take oral contraceptive pills have less premenstrual syndrome because they have less fluctuations in hormones.
Yeah,
so
because
that's
you're
one
regulating their periods.
Correct.
Right.
That's one. Number 2, we do a quick little trick. We give non-steroidal drugs such as Advil, Aleve.
So over-the-counter anti-inflammatories
Once
that
a
you can buy.
day for the week before your period.
For the week
without
before.
any pain, without any other symptom
Just
that you would
take
take
it.
once a day. It prevents the production of what we call prostaglandins, which is the substance that causes all the problems in the
So
body.
that's being secreted right before
Correct.
you have the actual
So it's a
period.
great trick. Once a day, an Advil or an Aleve for a week before.
Okay.
If all that doesn't work, we then can pulse drugs such as Prozac, Paxil, Zoloft in a pulse form
So
1
interestingly,
week before.
the SSRI group again, the
Back in-
serotonin reuptake inhibitor, is back and it's being used for PMS.
In a
now,
7-day
how does
form.
that work? So you're giving it how often?
We just give it for the week before in a pulse dose, once a day for 7 days. There is a study from Harvard that shows that this is very effective without any side effects of withdrawal of serotonin.
Really? That's very interesting. But before we go on to Dr. Henninger, what did you mean by pulsing Prozac?
It's interesting. It's similar to an interval training when you're running, when you do something for a short burst. So
Right.
when we pulse a drug, we use it for a short burst.
So
Meaning
instead of taking it every day, you're just taking it for that week.
just for
So
that
it's
week,
a pulse dose.
or just 1 Advil a day as opposed to 2 every 6 hours.
I
Just
got
a pulse of it.
All right. Dr. Henninger, you heard this again. Here's SSRIs again. Once again, how do you feel about that?
Yeah, this is where conventional medicine makes no sense to me. And many of the patients who come in to see me, they go to see their gynecologist for PMS. The gynecologist gives them more hormone, more birth control pill. Is that fixing the problem? No, it's exacerbating it in many ways. You know, PMS is fundamental hormone imbalance. So there's an estrogen progesterone problem in the end of the cycle, the last 14 days. So where natural medicine really shines here is that it corrects the hormone balance as opposed to giving more hormone, which is really just sort of throwing the body into further imbalance.
How would you correct the hormone balance?
So we do that with botanicals. We have wonderful botanicals at our disposal. We have something called chaste tree berry, which balances progesterone, estrogen. We have something called DIM, diindolylmethane, which actually removes estrogen from the body. Other herbs, dong quai. There's another aspect to this, which is liver function. In many of my patients who come in with PMS, the liver isn't conjugating estrogen correctly, which means it's not getting rid of estrogen correctly. And high estrogen is really the problem with PMS. All of the symptoms that you spoke about, the bloating, the breast tenderness, is a symptom of high estrogen. So when the liver isn't getting rid of estrogen correctly, we support the liver with natural things. Very easy.
Like milk thistle?
Milk thistle, exactly. Artichoke.
My mother loves artichoke for everything.
Yeah.
So that would be very good
Yeah,
for liver.
dandelion tea is
Dandelion,
wonderful.
right.
Green juices, greens powders, wonderful
So
as
I
well.
could imagine, I could understand correcting the liver so it can conjugate the estrogen.
Right.
But I think in giving birth control, you are giving hormone. but you're preventing the production of the patient's hormones. So it's not giving an additional estrogen. Am I wrong in my thinking?
It's controlling the levels. It's keeping the levels constant in the body as opposed to an up and down.
Am I confused?
Well, what the birth control pill does is prevents ovulation. So it tricks the body into thinking it's pregnant, so it doesn't
Right, but I
ovulate.
just want to make a point that it's not giving additional hormones upon what you're already producing. It's stopping
No,
your
birth control
production.
pill is actually estrogen. That's what it is.
Right,
That's,
exactly.
Yeah, so
but it's giving it in a dose.
Correct, that's
Right.
correct.
I'm just trying to understand that
That's
because I
correct.
never took a pill before to prevent me from getting pregnant, thank God. All right, we need to wrap things up, but first, I want to thank you both very much. You really enlightened me, and I hope you
Thanks for having
enlighten
us.
the audience. Your wealth of information was invaluable. We'll be right back. Oh, I'm going to say, I don't know.
Oh, yeah,
I
that
don't,
was
you know,
great.
let me tell you. Welcome back. Today we tackle birth control, beating depression, and putting an end to PMS. Here's my spin. I'm all for the prevention of unwanted pregnancies, but I'm a huge advocate for safe sex to protect against sexually transmitted diseases. If you choose to go on birth control, whether it be the pill, IUD, or ring, use a condom. Remember, you may be in a monogamous relationship, but that doesn't mean he is. And if you're experiencing feelings of persistent depression, consider meeting with a therapist. The advice of a licensed psychotherapist is the best money you'll ever spend. Consider it an investment in yourself. And finally, for women who suffer from PMS, my advice is to exercise and add magnesium, vitamin B6, omega-3 fatty acids, and calcium to your diet. I'm Dr. Frank Spinelli. Hope to see you again soon for more healthy discussions as you discover your path for your own personal prescription on Dueling Doctors. And as always, be sure to talk to your healthcare provider first before making any medical decisions. We'll see you next time. Is it long? You sure?